Hello everyone, I am Dr. Vivek Venkatramani, consultant uro-oncologist and robotic surgeon. Robotic radical prostatectomy is one of the commonest surgeries I perform today. Because prostate cancer is such a common disease affecting almost 1 in 8 men, robotic prostatectomy has an excellent oncologic outcome, meaning the cancer control rates are excellent. However, there are numerous quality of life issues that can arise out of this surgery. And of course, all men are concerned about this. So let's go through a bit about how you would recover after undergoing this surgery. Robotic radical prostatectomy is a minimally invasive surgery. So generally, the recovery in the hospital is pretty rapid. Most men will be walking the day off or the next day after surgery. They will be on liquids within 6 hours of surgery. And depending on how they recover, the diet will be advanced. Usually, most men are eating and walking and moving around 2 to 3 days after surgery and are ready to be discharged home. After the surgery, we put a catheter through the urinary bladder, which allows things to heal, and this may be kept for a week or two depending on the complexity of the surgery. When men wake up after surgery, they are a little uncomfortable with the catheter. However, they get used to the discomfort pretty quickly and they are quite comfortable with it within 24 hours. The catheter is quite easy to manage at home and it just needs to be emptied at regular intervals. There is usually also a small drain in the abdomen which allows old blood or sometimes a urine collection to come out. This is usually removed a couple of days after surgery before the patient is discharged home. The patient is then called for a follow-up visit in the outpatient clinic where we remove the catheter, check on all the incisions, and then discuss the pathology report at that time. Once the catheter is removed, all men will have some degree of urinary leakage or urine incontinence. The degree of incontinence depends on the complexity of the surgery as well as certain patient factors. We always train all men after the surgery to perform pelvic floor exercises or Kegel exercises which help them to recover continence much faster after surgery. If there is a long gap between diagnosis and the surgery, men can start these exercises even pre-operatively or before surgery, which allows them to be more familiar with it after surgery as well as recover faster. Some men are often into yoga, and in that Ashwini Mudra is one of the common things that is taught to them, and this is also a form of pelvic floor exercise which can be done after surgery in order to accelerate recovery. Most men will recover their urine control in about 3 months after surgery. In some cases, it may take 6 to 12 months, and almost 99% of men will be completely dry by a year after surgery. Very, very rarely, less than 1%, if the men are not continent or dry more than a year after surgery, another small procedure of a sling or a tape which helps to strengthen the pelvic floor may be needed. The second common long-term effect of any prostate surgery for prostate cancer is erectile dysfunction. Because the nerves which go and supply the penis for an erection are situated right around the prostate. So if the prostate cancer is very much contained within the prostate, we are able to save these nerves during surgery, which allows men to recover their erections. The erections would still never be as strong as they were before the surgery, and the function depends on the age and other comorbid factors like diabetes and smoking. Even if the nerves are spared, erections may take about 6 to 12 months to recover to a baseline, which are adequate for intercourse. During these months, we support the man with a penile rehabilitation regimen, which includes medication and sometimes a vacuum pump to be able to maintain blood flow and achieve a normal erection. In case the tumor is locally advanced or coming out of the prostate, we are not able to spare these nerves, and the return of erectile function may be even more delayed, or in about 30 to 40% of men, it may not be possible after surgery. We usually wait for up to 2 years after surgery to see what recovery may happen in the erectile function. And in case the man is very keen and motivated even after that, then a small surgery of a penile prosthesis may be needed for them to achieve erection after surgery. So all in all, prostate cancer surgery does have potential for long-term effects. But with the robotic approach, short-term complications like pain, bleeding, infection are very minimal, and discharge is very rapid, allowing a rapid recovery and return to work. Long-term functional effects like urinary incontinence or leakage and erectile function have also improved with the robotic approach, but a very small minority of men may need corrective procedures in the future. Please like, share and subscribe to my YouTube channel. Thank you.